Good afternoon, everyone. Welcome to today's SVS VQI Quality Improvement webinar. My name is Jennifer Correa, and I'm the Marketing Manager at the SVS PSO. I'm joined today by Betsy Weimer, SVS PSO Director of Quality, as well as our guest speaker. Before I turn things over to Betsy to introduce our guest speaker, I do want to go over a few brief housekeeping items. We will be keeping all lines muted throughout today's presentation, but would encourage you to type your questions in the Zoom Q&A box. This will allow us the opportunity to answer questions as time allows at the end of the presentation. In the event that we are not able to answer your question live during this session, we will reach out to you via email following the webinar. We do expect today's webinar to go a little longer than planned, but please just know we will record this webinar, so if you're not able to stay on the line, we will make the recording available to you. And with that, I'll turn things over to you, Betsy.
Awesome. Thank you so much, Jen. Welcome, everybody, and happy Tuesday. So I just wanted to review our agenda today. We're just going to touch base on all of our participation points and review our 4 domains. Just as a reminder, the cutoff for the participation points is always a calendar year. So the cutoff to send in anything for your participation points is the end of the year, 12/31. At 23:59 Eastern Standard Time. There are no exceptions. And today we have our wonderful guest speaker, Rasha Nodine. Many of you know her from the SOVANET region, and she is going to share her participation point maintenance calculation and also her data manager FTE calculation as well. And we'll also take Q&A too. So we're going to go ahead and get started. So our quality improvement participation points. As you may be aware, you may not be, we have a participation committee that meets quarterly. Actually, our next meeting is next week, December 19th. We always meet 4 times a year. Next meeting is in December. And then every year we meet in January to touch base on our participation point domains. It is a multidisciplinary committee. It has physicians, PAs, nurses, and technologists on there. Our participation awards began in 2016, and your participation points are calculated for the entire calendar year. So again, that goes from January through December. It is the center responsibility just to kind of maintain your points throughout your year, kind of know where you are throughout the year. And then we tabulate that annually. And again, on your right-hand side of your screen, you can see the reporting schedule. And then I highlighted it in red. So the 2024 STAR certificate is anticipated to be cut at the end of February, the beginning of February of next year. And then we always share that a few months later. And again, the procedure time frame for that is 2024, the whole calendar year, as I shared. And then once it is published through the ShareAFile, centers will have 2 weeks for adjudication. So as I mentioned before, the participation points, there are 4 domains in that category. So the first domain is long-term follow-up, which is weighted at 40%. Domain 2 is our regional meeting attendance at 30% weight. Domain 3 is your QI projects, which are 25% weighted. And then domain 4 are registry subscriptions, which are 5% weighted. And then the final score is actually tabulated, and you can see there the calculation. So the maximum number of points for any domain is 6 points. And the points needed for our various star levels, for 0 stars, it's less than 17 points. 1 star is 17 to 26 points. 2 stars are 27 to 40 points. And 3 stars are greater than 40 points. So let's talk about long-term follow-up, the first domain. So again, this is the heaviest weighted domain. This is at 40%. Now, this is actually a calculation performed by our analytics group. And again, just as a reminder, our center's long-term follow-up rate is determined according to this scale right here on your screen. So the long-term follow-up that is greater or equal to 90%, you get 6 points. Long-term follow-up rate greater or equal to 80% is 4 points. Greater or equal to 70%, 2 points. And then less than 70% is 0 points. Now, a lot of people aren't aware of something that Pathways has done. And I just wanted to let all of you know about this, because again, some of you know, some of you don't. So when you're signed into your Pathways account, make sure you go to Tools. You're going to select Long-Term Follow-Up Completion Rate by the procedure. And then you can see your completion rate on the right-hand side with that red arrow. And you can kind of see where you are. And you can see whether or not your cases, your follow-up cases, are in the numerator or in the denominator. And that's that screenshot down at the bottom of the screen. I did have a question, and it's a great one. Thank you, Jill, for reminding me this. The varicose vein module is not included in the long-term follow-up. So thank you for reminding me. That was great. You beat me to that early. So thank you. All right, so again, this is all from FIVOS. So again, they worked hard to make sure that they were trying to help all of us and help you with this long-term follow-up. So again, it's just a procedure report that was created for you to monitor your long-term follow-up rates in real time. So again, you can access the long-term follow-up completion report. Again, go to your Tools tab in your Pathway. Again, you select that Tools. Then you go to your long-term follow-up completion rate by procedure. Then you can toggle and enter your procedure date range that you want to review. You click your registry name you can actually look at your rules and your definitions by the registry. And then you can drill down and you can look up your follow-up and procedure records that are included in the calculated rate. And then you can actually click on those. And then you can filter it by the numerator and review the long-term follow-up records that do not meet the requirements. And again, if you have any questions on this, you can contact Pathways support for this. Sorry, I see a couple of questions real quick. So this is long-term, you are correct. So this will be long-term follow-up 2022. That's where we'll be at for this one. We're always 2 years behind. Keep that in mind. I know we're looking at long-term, our long-term follow-up is 9 to 21 months post-procedure, but for purposes of participation points, it's always 2 years behind. I know that can be a little confusing, so great question. So that's long-term follow-up. So our second domain is our regional meeting attendance, which is at 30% weighted. So again, our regional meeting attendance is important. Now, it's a little bit different for your physicians, and then also what we consider our support staff. So again, for centers with 3 or more physicians, you get 1 point for each physician that attends, and there's a max cap of that of 3 points. If a site only has 2 physicians and 1 physician attends, you get 2 points. And then if a site has less than 3 physicians and all of them attend, you get 3 points. Now, support staff, that includes your fellows, residents, PAs, NPs, nurses, data abstractors, technologists, everyone anyone other than an MD that has an active Pathways account kind of falls into this category. But again, that's the key. They must have an active Pathways account. And the other thing that I want to stress here is for regional meeting attendance, it is so important. This is why we always ask that you put your full name into that chat box, because we can't figure out, for example, B. Weimer, or BW. If I signed into a regional meeting and I just put BW or BW iPhone, that's why we're always kind of giving you all a hard time saying, could you please put your first and last name in? And there are a lot of like B. Smiths. There's a lot of Smiths, a lot of Johnsons and that sort of thing. So that's why we do ask that you put your full name into the chat box when we hold our regional meetings, because we can't always identify you unless we have that full name. So again, you have to have an active Pathways account. Again, one question that I do get throughout the year is, clarification on the regional medical directors and regional lead data managers. Keep in mind, these are those that have been identified, and there's usually only one or two for each region. For example, regional lead data managers, there could be a co-lead, so there may be one or two for a region, but pretty much there's 18. Sorry, just making sure. So Kendra was just verifying. So for the long-term follow-up, it'll be 2022, Kendra. Now, also, something that we added this year, VQI VAM attendance. So in the past, it was you had to be in person. So this year, I just wanted to point out, we did add that we took virtual attendance as well. Again, this is only for non-physician staff members, but we took in-person and virtual attendance as well. So I know a lot of extra points were given this year. So that was something that was added this year from the participation committee. So that's pretty much it on regional meeting attendance. And again, if you have any questions, feel free to reach out to me directly. Now for our domain 3, our QI project, this is 25%. We actually went up this year to 25%. It was 20%. So again, as all other domains, you have a maximum of 6 participation points for this. Each center is allowed to submit 1 charter per year. You can submit others. I'm happy to maintain, your projects for you. I do that for several centers. I have no problem, but you do get participation points for 1 charter per center per year. You can also present a QI project to your hospital board and/or C-suite. You can do this twice a year. And I actually have a sample of a C-suite presentation on VQI website if you'd like to see that. You can also present a QI project presentation or poster at our VQI VAM or another vascular annual meeting. I just need kind of proof. And if you have questions about that, email me. You can publish. I know a lot of you are wonderful authors. I know a lot of you publish, but you need to, submit that to me as well. And then again, we also have a couple of bonus points on your excellent performance rates on our national QI initiatives, which Katie in our analytics group tallies up and provides those bonus points as well. So again, there's a whole host of ways you can obtain a QI project with 25% weighted bonus here. So anyway, if you have questions, just let me know. But there are examples of these on our website. And then our last domain is our registry subscriptions. And if you have 1 to 2 registries, there's no points for that. 3 to 5 registries, there's 2. 6 to 8 registries, you get 4 bonus points. And then greater than 9 registries, you get 6 points. And then again, if you're a center that is only veins and could only possibly subscribe to a registry, you get 1 point. Now, something else I do want to stress, if you have suggestions or you have questions or anything like that you would like for me to take to the participation committee, I would be more than happy to take that to them on your behalf. But those are pretty much the 4 domains, just kind of a quick review. Again, the participation committee reviews all domains every January and take into any consideration any thoughts for considering for future bonus points. We will be taking into consideration the vascular verification program next week at our upcoming meeting. So that is one possibility. So just things like that do come up, and we always take it, very seriously. So anyway, so we will just, listen. We always, welcome any thoughts or comments. Danette, yes, the slide deck and also recording will be available after this presentation. And then with that, I'm actually would like to welcome Rasha Nodine. Many of you know her. She's out of the SOVANET region. She's a quality improvement consultant and VQI and IRAD registry site manager for the Baylor, Scott, and White centers. And she is actually going to share 2 things with us today. And I'm super excited to have her with us today. And if you have any questions or anything, if you could just put those into the Q&A box, that would be great. And Tegan, if I will answer your question personally. And I'm going to stop sharing because Rasha is going to share with us her own screen. So give us just a moment while we switch over. And also while we're switching over, I just want to let you know that Rasha's tools are available on the website. So right whenever you get to vqi.org, you can go to the quality improvement tile, and these will be available. Actually, they're already available for you.
Okay,
And with that, I'll turn it over. Thank you, Rasha, for joining us.
well, thank you for having me. So Betsy has already introduced me as the VQI and IRAD registry site manager and with Baylor Scott and White. So appreciate you having me, Betsy. Sorry, can you see my screen?
Yes, we sure can.
All right. So Betsy has asked me to present two calculators to you guys today. One is the VQI participation points for STAR awards, and the other one is how many FTEs you're going to need to do VQI in your center. And this is just a guide. It's not a final say. So really make sure you take a look at it before you, really go with it. So it's sort of a stepping stone for some people, but for others, it might be a yellow brick road. I know it's super corny. I've done posters for both of these. And so the one for the STAR rating is called Reaching for the Stars. And so what is it? It's a calculator that calculates your points in all four of the participation point domains to help you possibly figure out your possible STAR rating. It also is a tracking method for meeting attendance, long-term follow-up, and quality improvement projects and presentations. So why would you want to use this? So facilities need to keep track of their potential STAR rating to see what their next steps are to get to the next STAR rating. You need to track your hospital's progress throughout the year. You need to keep track of things that you've done in all of your domains for future reference. And that'll give you confidence in your STAR rating when the preliminary ratings are emailed to you by VQI. And so if there's any discrepancy that you see, this will kind of help to kind of figure out where that discrepancy is. And that way you can have a conversation with Betsy about it. It might be as simple as you told her to attribute a presentation to a different hospital because you might have, 10 hospitals that you work with. And so that kind of helps facilitate that conversation with her. It also helps to have visuals to present to your C-suite or your physicians, because if you need to get to that next level of your stars to achieve a 3-star, then you may be able to present this and tell your doctors, hey, I need more follow-up, or I need more, doctors at the next regional meeting so that we can get a 3-star. This also helps reduce time spent on calculating the STAR ratings over time. I calculate my STAR rating quarterly, but then I would start to mock up stuff like, if I were to get more follow-up, what STAR rating would that be? If I got more people at my meetings, what would that be? So it was becoming very time consuming. So I created this. So how does this calculator work? I'll go over to the calculator in a minute, but first you want to complete the columns that are in gray and follow the instructions that are at the top of the column, because some of them say mark with an X, some say, mark with a number. And then everything is going to be calculated for you. So your total points in each row is going to be calculated, but also the scoring in each domain is going to be calculated. As Betsy was stating, each domain is weighted. So that total scoring is with the weight that it's supposed to be. And there's fail safes in most of the cells. So what that means is that there's hard stops in some of the cells that will not let you make an entry that is over the max amount that VQI allows. It'll stop you and make you go back and change it. There's also fail safes in the actual total number for the domain down there at the bottom. It will calculate your actual points until you hit that max, and then it will only calculate the max within that total scoring. And I'll show you in a minute. And then read all of the notes that are on the sides, because those are all the VQI criteria that I pulled off from the criteria that was provided on vqi.org. But also look at that criteria too. So it's also a tracking system to track your QI and your QI projects and your presentations, your meeting attendance, as well as your follow-up. So I'm going to go into, can you still see my screen now that it's the calculator, Betsy?
Sure can. Thank you.
Okay. So I'm just going to quickly show you this. So I have a facility name up here just because I work with several hospitals, but all you have to do is like you put an X in here like it says, and it will calculate your points for that. And then it calculates the entire points for the domain. And so that was for your follow-up. You can see how it's weighted. You can see also how it's weighted over here. Your meeting attendance, there's all the categories for it. I just wanted to show you how a fail-safe works. So if I were at a site that had 3 or more physicians and say 4 of my physicians showed up, the max is 3, but say I didn't read that and I try to put in a 4, it's going to pop up and make me re-enter that as it should be. So it'll tell me what it's supposed to be. Now the total count below, the max there is 6. So if I were to start entering information, right now it's at a 5, so it's still counting 5. But if I were to enter more, so it's still counting 6, but if I go up to a 7, it's still only going to count 6. So it's not going to take you over your total amount. And so you've got your spring meeting and your fall meeting for your attendees. And then that's all the categories. And then your VQI band, it's just the one right here. And then here is all your quality improvement projects and your process and your presentations. And it also has the fail safe because you're not supposed to go above 6 on this. And then here is your registry subscriptions. And so I just kind of wanted to show you how the star rating works. So in the yellow box, you have your score. And right now we're at a 1 star. And I'm going to go and I'm going to change my long-term follow-up to 80%. And that's going to change us to 2 stars. And then if I change us to 90%, it's going to change us to 3 stars. So, and as Betsy said, this is calendar year January 1 to December 31st, but the long-term follow-up is 2 years prior. And then anything that you need to talk to Betsy about or turn in, do this before December 31st. So I have that all throughout. The meeting attendance template that I have here to keep track of all the meetings, I have the fall, the spring, and VQI band. So what I do is I enter the date of the meeting, I enter the attendees, and then I enter whether they attended virtual or in person. And that's to keep track of it for me. My quality improvement projects and presentations, I have all of the anything that you can possibly turn in for that domain here. And then I have all of the project, like the names and dates up here. This is way more than what you can turn in, but I still like to keep track. And I'm just going to give an example for the presentations of how I take care of this. I put in here the name of the presentation, when I presented it, where I presented it, when I submitted it to Betsy, and when Betsy approved it. And if I don't meet any of those, I keep it red. So like this one right here, Betsy has not approved. So it's red until she approves it, and then I turn it black just to make sure I know that I'm done. I also have follow-up that I keep track of. I do it throughout the year. That way I can talk to my doctors and say, we need 5 more. So, I have the score, the date, the numerator and denominator, just so I can kind of keep track of that. So that is that calculator. Now I'm going to go back to my FTE calculator. So this one is a workbook and a calculator that helps calculate the number of FTEs needed to do data abstraction. It'll also calculate data abstraction plus follow-up, but then there's also a section in there for a quality consultant like me, or it can be an admin assistant, a manager, a director, any position that does data abstraction plus anything more. And then there's also the calculator for a regional lead. So it's all combined. So why would you use this? People have used it to write a new business plan when you're bringing VQI into your facility for the first time. You can use it to justify if you need more help. And then if you're outsourcing your data abstraction, it might help in the communication with them regarding your caseload. So step 1 of this, you don't have to do anything with this. It's fully calculated, but I put this on here so you know where everything is attached. Like all of the calculations are based on this work capacity. And what it is, it's a 40-hour work week, 52 hours of 52 weeks per year at an 80% work week. And what that means is that we take into account vacation, sick time, lunch, breaks, and downtime. That's where the 80% capacity comes from. So step 2, if you do any kind of anything beyond abstraction, then you probably want to do a time study, and it's called the consultant time study. And I'll show that to you in a minute. Numbers will be populated from that time study over into the calculator. Times can be estimated or actual. If you're just doing abstraction, you can skip this step. But if you are doing more, then it's probably a really good idea to do this time study. Here is the time study. And we suggest that you do it for 3 months. And the reason, I know it seems like a long time, but once you start doing it, it's not horrible. But we all know that we get those projects thrown on our desk that are one-offs that we don't do on a regular basis, that we want to capture to get a very clear idea of what we do on a daily basis. So that's why we say 3 months. Your regional and VQI VAM, it's counted as a regular yearly thing. So make sure you capture everything that has to do with both of your regional meetings and your VQI VAM. And like I said, these will populate into a calculator here, and then it populates onto the calculator on the main page. Now, step 3 is your registry volumes. So first, you're going to go in here and you're going to enter all of your volumes for the registries that you are going to subscribe to. And you're going to try to enter the volumes that you will actually that are actually going to be included. So either going, by what you've already entered or looking up by CPT codes, try to get as close to exact as you can, so you have a really good view of what you're doing. Your minutes between each case and your follow-up, those are sums of what you have entered for your yearly volumes, because we always want to count minutes between each case, because there is downtime between these cases that we don't count, but it does add up. And then you're always going to do follow-up on every single case. You can definitely change the timing over here, because it just depends on what you do for follow-up, on how many minutes it takes. And then you have exclusion screening, because sometimes we don't think about this, that how much time we spend on excluding cases, but we do need to count for that. And then here, the times that are in here right now are averages that I got from a national survey that I did a few years ago. The registries have changed a little bit, but I think that the times are still the same for the most part. So you can leave these the same as they are, or you can do a time study to get exact times of what you're doing. So here's the time study for that. This is really easy. There's a time study for each registry. You just put the time in minutes for each case that you do. You can put the MRN in the comments, or you can put, like, if it took you longer than normal to do a case, you can put, you know, the patient stayed there for 3 months. And then you take this average in minutes and you put this over here in whatever call or whatever block that it needs to go. The reason I don't have this one reading from the time study is because we do have these averages in here, and a lot of people would rather use the averages than to go do a time study. So since we already have these, I've left them in there. And like I said, there is a lead data manager time study. So if you do that, then that will also populate. And then once it's done, it will tell you how many FTEs you need for abstraction plus follow-up, and those plus being a quality manager or anything above that. And then also your regional lead. So this doesn't mean you need a full person to be a regional lead. It just means you need a little bit extra if you're going to be a regional lead. So I'm just going to show you really quick that, oops, now I'm stuck. Okay. I'm going to show you really quick that calculator, which it's not going to take very long, but this is what it looks like. Here is the consultant time study. So what I do is I write everything down on a piece of paper. I, you know, combine like items. So if I did 40 emails that day, I add up the minutes, I put emails, and I put 30 minutes. And like I said, that all adds up over here, and then it goes to the main calculator. So if you have one of these on your time study, these little calculators, they're going to go over to the big calculators. And here's your case time study. And then here's your lead data manager time study. So that is what I have. So I don't know, Betsy, if there's any questions or if they just email me.
Well, I think you did a lot of hard work and efforts in putting both of those spreadsheets together. So amazing. So thank you, Rasha. That was great. And the fact that, I mean, so this last one, just so the first one, everybody knows, that was actually a poster that Rasha did this year at 2024 VQI at VAM. And then her FTE calculation, you did the first one, what, 2019, and then you updated it, or was it 2020?
Oh gosh, I think it was 2019 is when I did
Okay.
it.
And then she's updated it since then. And so every time she updates it, Rasha's gracious enough to always, you know, provide us with the most current spreadsheet. So, so anyway, I do want to thank Rasha for actually sharing all of her hard work with us. You've gotten a lot of kudos in the comments, so I've just been taking those. Now we do have couple of raised hands. So, is there a template to collect points and receive reward and date ranges from 1/1 to 9/30, in which we receive 6 points from each campus? Info from Sheriff File, QI Initiative Fall. No, we don't have a template at all. Just what Rasha has from hers. No, Michelle, there is no specific template on collecting points. The only thing you can do is to download Rasha's, template, and begin it using that moving forward in January 2025. I would definitely say that. You can start your own spreadsheet. Our analytics team actually maintains everything. What I do, just so everyone knows, is I have an Excel file, and so Angela Chirilla, she maintains all the regional meeting points. I maintain all the C-suite, VQI VAM attendance, charters, things like that, just so you know. So that's what I do. And so as of this morning, I have 77 charters for the year. And I currently have I have 598 entries for C-suite presentations, presentations on QI, publications. That spreadsheet also includes VQI at BAM attendance, virtual and live. So that actually increased from last year. I only had like half of that, like 300 and something. So yeah, so I do maintain that. So yeah, it's a team effort. So lots of kudos here, Rasha.
Thank you.
And Susan, the exact location, I can tell you, VQI, make sure you're in members only section. You can go to the quality improvement tile and under tools, and then you'll have to look for FTE. One of them says FTE, and then the other one is under participation points. And then Kelly Bailey has her hand raised, and then I don't see, let's see here. Kelly wrote, and someone else had their hand raised. Oh, Susan Gatton. So Kelly, if you want to take yourself off mute, or Jen, can you take her off mute? I don't know if we can do that.
Now, let me just try.
We're going to try.
Okay, I think that worked.
Yeah, but again, Rasha did all the hard work for all of us. So. And we'll make sure that we have all the links up and everything for everybody. We'll have all of this published and everything by the end of the week.
Betsy, both of my calculators, I've updated them in the past couple of days because I've seen some glitches in it. So I'm going to send those to you right after this.
Okay, perfect. So as y'all just heard Rasha, she's just going to update, send me her updated spreadsheets, and Jen and I'll work to get those taken care of too. So don't use the ones that are already there. So we'll update those and have those up by the end of the week. What's today, Tuesday? We can have them up by Thursday, right, Jen?
Yeah, that should be fine.
Okay.
And I just want to remind people that these are in members only. So you will need to go to the quality area of members only. If you do not have a members only account, you will need to reach out to me for that. So that's jkorea@svspso.org. But again, it won't be on the main quality section of the website. It'll be in members only.
So your participation points, I do want to clarify something. Participation points are not maintained in Pathways at all. I only showed you the long-term follow-up. That's something in Pathways. That's just a tool for you to use. You don't have to. That was just something that is newer. And I just wanted to make sure that you have access to those. That's all. So we, as the SVS PSO, we maintain all the participation points. So analytics team, they calculate your long-term follow-up rate. They do that behind the scenes. I'm not privy to their algorithms. And they also calculate your bonus points based on the NQIs. So I'm not privy to that algorithm either. They also know how many registries, you subscribe to. So they take care of that. I do all of the QI domains. Angela does the regional meeting. I have a massive spreadsheet that, I pull that into my spreadsheet. And then, I also maintain, all the VQI exam attendance. So yeah, so no participation points are in pathways. Just want to make sure that's up. But yeah, you need to submit anything and everything to myself. Regional meeting attendance is done by Angela though. And then we're going to be updating everything on Thursday because Rush is going to send me some updated links. So we'll have all that by Thursday. So everything will be updated by Thursday with the slides and with new updated links. So our next quality webinar will be January 14th. Just so all of you know and are aware, we're going to review all three of our yes, the calculator too will be coming. So on January 14th, we're going to review all three national quality initiatives, and I'm going to be sharing about smoking cessation and the consideration of participation points for that. And then beginning January 28th, I'm going to be doing a 12-month webinar series based upon my training as becoming a certified tobacco treatment specialist. So those are going to be special. So all of the resources and PowerPoints and slides and recordings for those 12 webinars will be housed separately in one special spot. And those are going to be for patients, physicians, APPs, nurses, it'd be for a little bit different, more broader audience. So that will be coming January 28th. So again, our next quality webinar will be January 14th. And again, that will be to review all three of our national quality initiatives and talking about future consideration for a bonus point for smoking cessation. So that will be coming too. So make sure there's one more thing. Oh yeah, so Jen just put into the chat box. You can go to members only, quality improvement tools. How many data managers does it take to ... And it says QI project with Rush's name on it. But again, we're going to be updating everything. And so that will be there by Thursday, by this Thursday. It should be there, Ashley. The calculator should be there too. But again, Jen and I'll make sure everything's up there at your fingertips. And we'll actually put it under not only from the webinar today, we'll also put it in the quality tools as well. So we'll make sure it's right there at your fingertips. So don't worry, we will get it there by close of business on Thursday. And we want to thank Rasha for all her time and her hard work and efforts in doing this. And just so you know, Rasha does get participation points for being here and being a speaker for our quality webinar today. So if you're interested in being a guest speaker and sharing your project or something you're working on, or a topic of interest or something like that in 2025, just let me know. Feel free to reach out, and we'd be happy to get you online with us. But other than that, I hope all of you have wonderful, happy holidays. And again, thank you, Rasha, for all that you do, and thank all of you for all that you do. And I hope everyone has a lovely day, and take care. We'll see you in January in the new year. So take care, everybody.
Bye.